With all of Medicare's parts and pieces, I bet you'd like some help understanding what it all means. Good news! We've created the top 10 things to know about Medicare to give you a better understanding. Number 1, you can have Original Medicare, which is Parts A and B, and it's offered through the federal government. Number 2, your prescription coverage is available through Medicare Part D. You have to add it to Original Medicare as a standalone plan. Remember, if you don't sign up for Part D when you become eligible for Medicare, you could end up paying more later. Number 3, your costs may be more than you think because Original Medicare does not cover all of your hospital and medical expenses. Those gaps could mean big bills if you get sick. Number 4, Medigap insurance plans, sometimes called Medicare supplemental plans, can help fill in the gaps with Medicare Parts A and B. Number 5, Medicare Advantage plans are offered by private insurance companies, and they provide your Part A, Part B, and many times Part D coverage. Number 6, it makes a difference where you live. Coverage for Parts A and B are the same all over the United States, but for Medigap, Medicare Advantage, and Part D, plans vary by state and in some cases even by counties. And with most Medicare plans, you still have to pay your Part B premium as well. Number 7, if you have insurance from your job or retiree insurance from a former employer, find out how it fits with Medicare. You may already be set and don't need to enroll in privately insured Medicare plan, but you still might want to enroll in Original Medicare. Number 8, don't put off enrolling because if you wait, you could end up paying more for coverage and have fewer choices down the road. Number 9, the good news is you're not stuck with your choices forever. You have a chance to change plans at least once a year, so it's a good idea to check your coverage each year to make sure that your plan continues to meet your needs. Number 10, ask for help. You can get help for reviewing your choices as well as for paying Medicare plan costs if you're living on a limited budget. And there you are. That's your top 10 things to know about Medicare. Wondering if a Medicare supplemental plan is right for you, or just wondering what it is? We are here to help. Medicare supplemental insurance plans, called Medigap plans, are designed to help pay some of the hospital medical costs not covered by Original Medicare Parts A and B. Medigap plans are offered by private insurance companies, and here's a quick overview of how they work. Medigap plans help cover some or all of the costs that you pay with Parts A and B, like deductibles, copays, and coinsurance. They also let you choose your doctor or provider, and they travel with you if you move or travel in the United States. They do not cover things like vision, hearing, dental, or long-term care, and they don't cover prescriptions. But you can choose to enroll in both a Medigap plan and Medicare Part D prescription drug plan. Policies and prices vary by insurance company, so it's important to compare monthly premiums, the type of coverage you'll get, and what your total monthly and annual costs would be to make sure that it fits your budget. Generally, you have to be enrolled in Original Medicare Parts A and B to buy a Medigap plan, and you have to continue to pay your Part B premium. Keep in mind, with a Medigap plan, you pay for both your Medicare Part B and Medigap plan premium. If a Medigap plan is right for you, the best time to buy is during the initial enrollment period, when you first become eligible for Medicare. There's a 7-month window that begins 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. If you sign up then, you can't be rejected or charged more for a prior medical condition. And that's Medigap. So take the time to review, compare, and decide if a Medigap plan makes sense for you. People are surprised to learn that Original Medicare Parts A and B do not cover prescription medications, but that's where Part D comes in. Medicare Part D is offered only by private insurance company, and it helps pay for prescriptions. You can get Part D either as a standalone plan or included in a Medicare Advantage plan. It's up to you depending on your needs and what's available in your area. Here's how Part D works. First, it's optional. But if you want it, you have to enroll. Second, depending on your situation, you can sign up for Part D when you first become eligible for Medicare. For most people, that's when you turn 65. If you decide to wait, you could be without prescription drug coverage when you need it, and then you might end up paying a higher premium. Third, Medicare Part D plans vary by company. So when you compare plans, you should make sure the drugs you take today are covered. And then review the drug copays, any required deductibles, and the monthly premiums. For most people, Part D is a smart choice, whether it's on their own or as part of a Medicare Advantage plan. It can help save you the cost of prescription medication, manage your health care budget, and provide coverage in case your health needs change in the future. And that's Medicare Part D in a nutshell. Medicare Part C is also called Medicare Advantage, and there's a good reason why. It's because Medicare Advantage plans help with the hospital costs, doctor visits, and other medical services that you get with original Medicare, but they can also include prescription drug coverage, vision, hearing, and even gym and health club memberships. All this comes in one plan with just one plan ID card. All Medicare Advantage plans are run by private insurance companies. So how can you get in on the Medicare Advantage? Well, first you must be eligible for Medicare and paying your Part B monthly premium. Many Medicare Advantage plans come with an annual deductible to keep your monthly premium down. You pay a copay or co-insurance for only those services you use and not for those you don't. Finally, to keep your costs down, you may have to pick a doctor that's in the plan's network. Some plans offer more choices and doctors by allowing you to get services outside of the network, but you may have to pay more. All plans are the same, but not all plans are available in every state or county. So you will need to find what plans are available in your area. You can enroll in Medicare Advantage when you hit the big 6-5 or once a year during the annual enrollment period. And that's a good look at what Medicare Advantage is all about.